We're going to discuss briefly sleep apnea. We've already talked about apnea in the younger child. We talked about sudden infant death syndrome. We talked about apnea of prematurity briefly. We talked about central versus obstructive versus mixed. And the most common is going to be the mixed apneas. But we're going to just talk a little bit about sleep apnea. And it kind of segued right from the prior discussion of tonsils and adenoids that are big. Many times sleep apnea in children occurs because of these large tonsils and large adenoids which cause airway obstruction. We can have patients who are overweight and can have obesity hypoventilation syndrome and have sleep apnea. Many children with sleep apnea due to large tonsils and adenoids don't do well in school. They fall asleep in school because they're not resting well through the night, so they're sleepy in school. They can have failure to thrive because of hypoxia and poor weight gain. These patients probably need further evaluation. The best test that they can have done is a sleep study, a polysomnograph, and it looks for whether they're having obstruction, having desaturations. And these patients many times will benefit from the removal of the tonsils and the adenoids.